Hi there, thanks for joining us. In 2017, the number of overdose deaths related to opioids was 6 times higher than what was reported in 1999. Today, about 130 Americans die every day to an overdose on opioids, according to the Center for Disease Control and Prevention. The North State, however, is not immune. In 2017, deaths attributed exclusively to opioids in Butte County was higher than the state average, including hospitalizations. Recognizing this startling trend, organizations like Enloe Medical Center are working hard to fight the opioid epidemic. Hi everyone, my name is Susie Larry Hall and I'm Enloe's Community Outreach Coordinator. I'm joined today with Dr. James Moore. He is an emergency medicine physician. I'm also joined with Jake Miller, and he's Enloe's substance use navigator. Here today to talk to us about this very important topic, so thanks for being here. Before we get started, please remember the information that we're about to share is not intended to be medical advice. If you have questions about the health of yourself or a loved one, please make sure you speak with your provider. If you have questions about opioid or substance use, you can also call Jake on his cell, 530-809-6003. And as always, please feel free to join the conversation. Post your comments and questions in the comments field, and we'll do our best to answer them throughout the broadcast. And with that, we're going to get started, okay? Dr. Moore, I'm going to start with you. If you could share with us, how did we get here? Like, what is the epidemic, and share a little bit about what that looked like.
Well, basically what we're seeing now and what's concerning us is just the dramatic rise in deaths, right? Mm-hmm. So let's go back 30 years when, as a healthcare industry, there was this push to make pain this fifth vital sign. There was this push to say patients should have zero pain, that be in the hospital, that be outpatient, that be from any source. And you couple that with the introduction of medications like OxyContin, whose manufacturers made claims that it was not addictive, and this is something that was totally safe as long as you had true pain, that it was never going to be a problem. And I'm not trying to lay blame on anybody there,
right.
But now we're obviously seeing that that's not exactly the case, because now 30 years down the line, we're struggling with what the consequences of that sort of paradigm was. So, that's involved a lot of changes in the way we view pain, in the way we prescribe medicines for pain, how we use adjuvant therapies for pain. But unfortunately, along the way, that's left a lot of people who have been on pain meds for 20 years finding now they don't have a provider to prescribe those medications without alternatives, who are often resorting to buying drugs illegally, using them inappropriately, and then many times even moving to, say, heroin when they can't have access to medications anymore. So now we're sort of fighting that back end of now trying to intervene with patients, changing their medications, using alternative therapies to try to get them off of these medications, providing psychosocial outreach for them. That's a lot of what Jake will talk about. Ultimately, the goal is to prevent deaths. That's the bottom line.
Wow, thank you for that. So, Jake, I'm going to go ahead and move it on to, like we mentioned, the numbers are staggering, right? It's pretty astonishing what's happening. Can you tell us a little bit more about what's happening here in Butte County?
So Butte County has has significantly higher rates than the state and national rates as far as drug-induced deaths, especially with the opioids. Other indicators also, we have a very high opioid prescription rate, which has been coming down, but is still higher than the state average, as well as the morphine milligram equivalence is also higher than the state. There's also co-prescribing of benzodiazepines with opioid pain medications, which is dangerous as well. And then we have the 5th highest rate of any county in the state for neonatal abstinence syndrome, which is for babies born dependent on opioids, and so they have some withdrawal symptoms. All of these indicators together put Butte County residents at a higher rate, risk for opioid misuse and opioid use disorder.
Wow, that's amazing. So that actually brings me to my next question. There's a misconception, I think, on who is considered dependent on opioids. Can you shed a little light on that for us, on who's at risk of opioid misuse?
So anyone who's been on prescribed opioids for an extended period of time for chronic pain conditions. Also, people who are on a rotation prescription for opioids or pain medications. There's a cross-tolerance issue that doesn't quite build up like.
What do you mean by cross-tolerance? Like, are you saying that someone's ability, like, is there like a ratio of time when someone is prescribed an opioid, and then what do you mean by that?
Well, it's rotating between medications.
Oh, okay.
So that it's really so that it's more effective and the person doesn't become dependent on
Okay, all
both
right.
of them, but in doing so, you actually don't build the tolerance like you normally would
Okay,
to a single medication.
okay. I understand that, okay.
Hope that.
No, I think so. So it sounds like, it sounds like essentially anyone who gets prescribed an opioid is essentially potentially at risk.
I think that's
that
one
what
of
we're saying?
one of the points that are important is, I think in the past there was a lot of stigma associated with the patients that had, problems with it, that they were going to be, you're young, homeless, deadbeat, use whatever words had been used in the past.
Mm-hmm.
And, surprisingly, if you look at middle-aged women, right, they're like the highest at-risk patient population, because this all starts very innocently. It starts with a sprained ankle that someone prescribed maybe a month's worth of oxycodone when maybe a week was enough. And they just start using the meds because they're prescribed. They build up a tolerance, a dependence, a physiologic dependence on it. So even when they don't truly have a pain state anymore, their body craves that medicine. The doctor may say, okay, here's another couple weeks, but we'll plan on getting you off it. And then that ball just starts rolling down the hill. And the next thing you know, it's 3 years later, and this nice, same, normal, middle-aged mom of two is buying OxyContin from the street corner. I mean, this is not something that's abnormal. This is how it actually plays out. So I think breaking down those stigmas of who you think has the problems really opens the conversation. So you're asking everybody the same questions. And I mean, I've seen that in the department now that my mind has even been opened a bit. I've got to admit, I had the same misconceptions 4 or 5 years ago. Before you start meeting people and you're surprised, like, oh my gosh, you have a problem? Boom, right? And I'm sure you can speak to that too. But some of the most rewarding stories I've seen are young, functional people who go out and work. They're college students, and they're afraid to admit it, and until they finally say, I've got a problem, this is how it started. And those are the ones that are really gratifying, because they're not the obvious people you're going to catch unless you're really trying to look for them.
Wow. So what is the symptoms of someone who might be misusing opioids? Because it sounds like you mentioned
Sure.
Yeah, can you share that with us?
Well, you can look at symptoms from a couple of different ways. You can look at it from social problems to physiologic problems. So from a social standpoint, if that drug craving becomes so ingrained in their daily habits, it might interfere with their family life. They're going to have interpersonal problems with family members, friends, coworkers. They may, kind of pull back from those relationships, which of course throws them deeper into the depression side of things. But also from a physiologic standpoint, your neurotransmitters are permanently affected. Your body is going to crave those medications however they can get them. So whether that means you're making up stories to come to the ER about injuries so you can hopefully get a prescription, or if you can't convince anyone to prescribe you something, then you're finding ways to get them on the internet or on the street. And if you can't find pills, then ultimately maybe you're moving towards fentanyl or heroin or something more illicit. So cravings could include maybe 24 hours to 48 hours after your last use, sweating, diarrhea, body aches. I mean, like imagine a really bad flu. That's kind of how people typically describe it. And in fact, that's often how they present in the ER when they don't come out and just tell you they're in withdrawal. Especially now in flu season, you always have to be mindful of, it sounds like flu. And then a couple times this year, I've just asked, hey, do you use anything? Well, actually, yeah. And it's been a couple days, and it's like, bing, give them a Suboxone, and like an hour later, they're shaking your hand. It's really amazing.
That brings us back to Jake. So Jake, tell us about your role here at Enloe and what we're doing to help with the folks who are struggling with this.
So my role is to go and talk to patients who have either been referred to me or have by either physicians or social workers, nurses, and go and talk to them, see what's going on with them, and kind of let them know what I do, let them know what Enloe does, what some of the physicians like Dr. Moore do. And then hopefully if there is a substance use issue going on, not hopefully it's going on, but if there is one going on, hopefully be able to support them in changing their lives. And so specifically around opioids, if they're open to starting medication-assisted treatment with something like Suboxone, then I would discuss with the physician that they're open to that and get them started on replacement medication, and then kind of coordinate a community provider referral so they can have ongoing support. And then follow up with the patient, make sure that they're still getting treatment, and if there's any barriers, how can we address those? So that's primarily what I do.
Sounds great. So how do we find you? How do we access you? Yeah.
Well, it's to be started on medication-assisted treatment. At Enloe, you would have to be a patient. So any patient that's in the hospital, if they are brave and open to discussing it with the nurse or social worker or physician, then typically I will be called and get started. If you're not a patient and just wondering how would I possibly get help, or I have a family member who needs help, you can always give me a call and I will talk you through it and try to find out how we can help.
That's really great. That's really amazing. Dr. Moore, what should people do if they're concerned about themselves or a loved one? Jake said we could just call him, which was generous, but...
Yeah, I mean, the easy answer is to call Jake or come to the emergency department, because one of the things we found is while there's a lot of community resources out there, often they're not very accessible, at least in that moment, because what we see is that patients might be vulnerable to intervention for just a little brief window before they use again or find the meds they were looking for. So it doesn't help always when they're saying, I really want to get help, or the family says, I really want to get you help, and they call one of our providers in the community and they say, yeah, we'll see you in 2 weeks. That works sometimes, but I think one of the real powerful things about the program here is that we meet the patients where they're at in that moment of vulnerability. So when they're coming in, they're withdrawing, that's the best chance to educate them, to convince them if it takes that, or just show them, how powerful and life-changing some kind of change in medication can be. I think that's been really powerful for us. So if family members are concerned, first just trying to maybe not confront, but just have an open conversation with that family member, showing how much you care for them. And even if you can convince them this much to come to talk to somebody else that has a little bit of knowledge about it, maybe that's enough.
Okay. Thank you guys for being here, and thank you so much for watching. If you have any questions for you and your loved one who might be struggling, please make sure you give us a call, 530-809-6003. Help is available.